And welcome back, our viewers, and how a beautiful report that was, very cultural and very remarkable. Thanks to everyone who is on the making of it. And now, as the temperatures begin to drop, our viewers, winter slowly makes its way into Kuwait. Beautiful thing, but yet many of us starts to notice the familiar symptoms of sneezing, coughing, sore throats, and seasonal colds during this time of year. The respiratory infections and the influenza become more common, especially among children, the elderly, and those with chronic conditions. To help us better to understand the difference between the simple cold and the flu, and how to protect ourselves and our families, and getting the flu and vaccines more important than ever. We're joined today by Dr. Ghanem Alsalem, consultant internal medicine and gastroenterology doctor. So please, doctor, thank you for being here with us, and thank you for helping us so much on this interview to understand more about these infectious and diseases.
Bismillahirrahmanirrahim. Good morning, and good morning Kuwait. Good morning to you. Good morning to everybody here in the studio and all behind the scenes and doing all the job. And as you know, the weather is getting better, mashallah. So we are trying to hope that it's the beautiful days of Kuwait for the coming few months. And we would like people to enjoy the weather without any sickness, of course.
Exactly, as we hope. But still, a lot of people don't go with the regulations, with the normal infectious and diseases regulations, which is to try to have get checked, or like the seasonal vaccinations. But other than that, Dr. Ghanem, as winter begins, and thank you for mentioning that, we often hear about the increase of seasonal illnesses. Could you explain why the cold weather trends to trigger these illnesses, especially at between the seasons? Like, why it's not in summer, at the mid of summer or winter?
That's a good question, actually, and it's a frequent question between individuals. Or the people all notice that during winter time you will have this season, flu season or common cold season, or people get sick during the winter time. Of course, there are reasons for that, and it can be explained very briefly to the audience to understand. We have two main factors: environmental and biological factors.
Yes.
What we mean by that is, during your normal days, your normal weather, you will have protections from your body. So the first line protection probably will be your skin, your mucus, your tears, and all of that. During winter time, you get dry, the body gets dry. So the mucus inside your nose become more dry. That gives more chance to the microorganisms like viruses, bacteria, or any others to stay more inside the nose and get the more chance to invade your body. That's one. Two, the biological reasons. We think that the viruses during winter time become more strong, more stable, more infectious. These viruses have the ability and capability of invading the bodies, human bodies, during winter time because of their biological nature. So that gives the chance for the viruses to peak during weather time when it's winter, and between, let's say, changing in the weather between hot and cold when the time of the season changes during the year.
Yes.
So these are the two main factors of seeing these patients and seeing the peak of infectious respiratory illness during that time.
Well, it's a little bit scary to hear about how it's get really strong, and it's get biologically for the virus itself during the winter. It is actually, for a lot of people, they need to be more aware about these things. And later question, maybe we can know how to prevent these diseases and know how to stay on the safe lines. But now, since we hear always about the common cold and influenza, in the terms of symptoms and severity, what are the difference between these two diseases?
Yeah, let me say that I agree with you that people get scared. That's why we have you, the Ministry of Information, and the Ministry of Health providing the information to the public so they can be not scared. As you know, the more knowledge you have, the better you can deal with these seasons and awareness. So I agree totally, and that's why our job here to spread the medical knowledge and information so people can treat and deal with these symptoms and deal with these seasonal changes. So back to your question, when you say what's the difference between common cold and flu. Common cold and flu are similar, but the difference is very huge. Both are caused by virus, but the virus is different family viruses. But the flu is very bad disease. common cold is mild. So patients may have runny nose, cough, maybe they have sneezing, maybe mild fever. So these are the common cold, and they may last for a few days. But the flu itself, that's why we need to pay attention to the flu. Flu is more dangerous. Flu can cause high-grade fever, can make you feel very bad, can make you feel tired, fatigue, and they may have more symptoms like chest pain, respiratory problems, shortness of breath. You may actually be sick, very sick. You cannot even eat or stay. You'll feel very tired. You may vomit. You may have a lot of symptoms. So, and it may last for a longer time. Okay, that's why we need to make aware of the differences between common cold and flu, because there are people who are vulnerable, or they have they cannot tolerate the disease, and they may get complications, admission to the hospital or admission to the ICU, or may actually cause death. So flu is a very bad disease.
Might reach it.
Yes, flu. Death is one of the complications of influenza infection. Yes, flu.
Okay, that's actually very serious.
Yes.
I mean, I thought at first that the influenza or let's say the flu and the cold, I thought they're only when it becomes more severe.
Yes.
I thought only that person has lower immunity system.
Yes, yes.
And they trigger on the same season, right?
Yes, exactly, because they are viruses. And as we said, the viruses get more stronger during winter time, and they're more infectious, so they can spread highly between individuals and community. But if you get the common cold, it's fine. You will feel a little bit tired. You may feel low-grade fever. You can deal with it. It's fine. So we are afraid of flu. The flu itself is very nasty, not nice disease to have, especially for those who are elderly or who are very young children, or those who are pregnant, or those who have a chronic disease like heart disease, kidney disease, asthma, COPD, or chronic lung disease. Those people who are very, or even pregnant ladies, they have more, let's say, dangerous situation if they get the flu vaccine.
Yes, thank you for the wonderful information about that. That's actually serious. So, for everyone, how can we know if we should stay at home and rest? Because that's a question that always stays in everyone's mind. That I don't want to go to the hospital, I don't want to get the cold, I just want to home and rest. And as you mentioned, that one of the complications for the flu might be death, God forbid.
Yes.
So how can we tell when we should stay at home and rest and when we should go to the hospital?
Of course, that's a good question. And Ministry of Health has put this in the social media a lot, when to visit a hospital, when to visit the polyclinic, and when you seek medical help. You need to see a doctor if you have high-grade fever, 39, 40 or above. If you feel shortness of breath, you cannot take your breath easily. If you feel chest pain, if you actually be dehydrated, because one of the complications of the flu infection is you get dehydration.
Yes.
Or if you have, like, let's say, coma or faint or confusion, these are indications that you are really sick and you need medical help. So these are the symptoms, and we need, let's say, them red flags. If you or anybody in your house or your family or your friends have any of these symptoms, high-grade fever above 40, 39 or 40, patient may have shortness of breath, chest pain, or the patient have dehydration or confusion, bring them to the hospital as soon as possible, because they really need a medical help to get them over this illness.
So is the flu vaccine really necessary every year? And how is it really going and effective to be in preventing the infections or reducing the complications, especially for the flu vaccine? Yeah,
that's a very good question, and it is the most frequent question being asked every year. At the same time, every year being asked this question. Duania in a home, in the hospital.
Every time.
Every time. So let's talk more about the flu vaccine itself. The flu vaccine, it's a vaccine to give you, to alarm your system, your immunity system, that there is something you may be exposed to. You need to be ready for it, okay? So it gives you an update to the viruses around you in the environment. The viruses, they change every year. The flu virus changes every year, and that's why what we call mutation. So the immunity may know the virus from last year, but they don't know the virus of this year.
That's why every year it's necessary.
That's why we need to do the vaccine every year. So it's an update to the immunity system. So having the vaccine last year does not prevent you from having the virus this year. So you need to update your system with the new vaccine. Now the vaccine is important for those who are at risk, mainly those who are elderly, pregnant ladies, patients with a chronic disease, those who are on immunity medication, low their immunity suppressants. These are patients who really need to be on the flu vaccine to prevent the complications of the flu. Others who feel healthy, they do need to take the vaccine. The vaccine is very important to reduce the risk of admission to the hospital. So the science says, or the evidence indicates that if we take the vaccine in the community, we reduce the hospital admission by 60 to 70%.
That's remarkable.
That is very good. So you reduce the pressure on the health system. That's one. Two, there is evidence, and good evidence, that they prevent death from the complications of the flu by up to 30 to 40%. So these are very important figures. We need to put the vaccine in the community to prevent the death, of course. And the most important thing is that the flu vaccine is available, it's free, and it has, let's say, very mild or very low side effects. So it is, let's say, it's a weapon we need to fight this microorganism, the viruses, against the seasonal flu.
That's actually blessed, alhamdulillah, in our beloved country, Kuwait, and thanks to the Ministry of Health that it's available, it's free. In another country, it is not, our viewers.
True.
So being healthy is a priority for our leaders, and it's really important for everyone. So as we know that the flu shot is required, but some people are afraid from the side effects of this shots, and that it might have some after effects or side effects during the vaccine working time. Can you reassure the hesitants and everyone about the side effect, if there is any, or if there is not, like maybe the low immunity system? A lot of people been saying that.
Sure. See, I have to say that after COVID-19, people's awareness of the vaccines became different, okay? So now we know more about the vaccine. The community knows more about the vaccine. A lot of people now can seek the knowledge and look for the information about the vaccines in a different way. And the awareness of the importance of having vaccination in the community became more stable and good in the community. So we have to say that the vaccine itself, it's good to prevent the bad flu. That's, if we put the side effects of the flu vaccine and the benefit of the flu vaccine, definitely the benefits are way better than having the side effects. And let's remember that the side effects of the flu vaccine are very minimal. You may have local reaction from the site of the injection. You may have low-grade fever, because that indicates that your immunity is working against the
even
virus.
for children, the vaccination
Exactly.
Okay.
It happens to all the vaccinations. So otherwise, there are no really serious complications of the flu vaccine. There's very rare one when you have a reaction to the vaccine, allergy to the vaccine, and it's 1 in a million maybe. So if you have high risk of having the flu, it's better to take the vaccine, because the benefit of the vaccine is way better and more benefit than having afraid of the flu vaccine side effects, which is very minimum and very minimal side effects and negligible really.
So it doesn't affect the fertility for a person?
No,
that's definitely.
No,
where it's, as you know.
I know, I hear that a lot. No, has no relation. There is no evidence to link between the vaccine and fertility.
For any vaccination, I believe.
I don't think there is any, to my knowledge, there is any link between any vaccination and fertility. Actually, it's the way around. If you have viruses, you may actually get infertility. It might affect, yes, of course.
Exactly. Thank you for the amazing reminder to everyone, and they are alerted. So, how can individuals with chronic diseases like diabetes, like asthma, digestive issues, help themselves in the prevention from the winter seasonal colds and flus? Yeah,
sure. That's, we say these are people who are really afraid of having the flu vaccine, because the disease is bad on them. They may hit them seriously and may cause admission to the hospital or admission to the intensive care unit. And we really don't want these people to get the virus of any kind of infection. For them, we always tell them that you need to keep your clean hands all the time. Don't touch your nose or eyes and nose or mouth with what you think maybe it's infected hand. So always keep your hand free, clean and free.
Like if you're in the gym or something.
Gym
Yes.
or in gathering or you know, socializing, you always keep your hand clean. The other thing, if you think there's a place where it's high risk of infection, like hospitals or crowded places or close crowd places, try to wear the mask. It will help a lot to reduce the risk of having the infection.
Yes.
The other thing is try to minimize your social contact. I don't say isolate yourself. No, attend.
Here where social media can go through.
Of course, but attend the social gathering and be in the socializing with careful touch. That means try to avoid kissing, try to avoid unnecessary, you know, handshaking if you can. That is very good. And if you see a person who is has the infection or is sick, stay away from them. That's a very good way to prevent you to having the infection. The other thing is make sure that you get the vaccine updated. The vaccine is a very good way and tool to prevent the infection. And I always advise them to visit their doctor frequently, take updates of what's happening around them, and make sure that they get good diet, good hydration, good sleep, and exercise. These are very good important points to keep your immunity updated and good to fight the virus.
Thank you, doctor, for everything. And these prevention methods, having a diet, healthy system life, have a healthy life system, and being active, that's for everyone.
Of course.
It will help them all. Thank you, Dr. Ghanem Alsalem, for everything, for being here with us and for helping us in your experience, for being aware, because to everyone, I believe it's really important to have more awareness, and for you being here with us to help us. Thank you for everything.
Thank you for having me, and I hope that we enjoy these days, beautiful days. Get out, get exercise, sleep well. You need a night's sleep. It's very important to get the night's sleep. In Kuwait, we don't really have a good night's sleep, so that's very good for your immunity system.
Exactly.
And get the good diet, get hydrated, and stay healthy, stay away from diseases.
Thank you for that, and of course, our dear viewers, thanks. All the appreciation to our guest, Dr. Ghanem Alsalem, a consultant international medicine and gastroenterology. Of course, now we have with us the beekeepers in Kuwait are preparing at this time of the year to support the bees for the second season of the honey after the summer and lower temperatures, the entry of the autumn season this month, and at the end of the summer season with the significant drop in the temperatures in late November and early December. More details about the advantages of the Kuwaiti honey in coinciding with the start of the second season of the Kuwaiti honey production. So let us see the following report, and then we'll be back, so stay tuned.